Welcome back to Ozarks Fox. The Taney County Health Department has released the 2019 Community Health Assessment results and some health priorities that surfaced with those results. And that's exactly what we're talking about here on Ozarks tonight. We have Lisa Marshall, who is the Director and PIO of the Taney County Health Department. Lisa, thank you so much for being here.
Thanks for having me.
So you were explaining to me what this health assessment is, and you said it's a 3-year period that you're looking at. Tell me about how you gather this information and why you do this health assessment in the first place.
Sure. So this is our 2019 Community Health Assessment, and basically we do this every 3 years. And this is a really important document in terms of guiding what we do for the next 3 years. So we go about a large evaluation and assessment process of the entire county. And again, we really look at this as it's not just the health department's information, it really is for the community. And we encourage our community members to use this and our residents to take a look at it because it is of interest. And so what we do is every 3 years we evaluate the health of our county and our community, and we do that through a number of evaluations and assessments. One of the things we do is a large survey that goes out to our residents, and this year we had groundbreaking numbers that we're really proud of. So we had over 1,700 Taney County residents respond to that, and we lean very, very heavily on that information because that's really what the residents want to see happen.
So over 1,700, is that just residents, or is that also including business owners? And
so basically, if you have a Taney County zip code or address or a Taney County resident, then you are welcome to take this survey because it is geared specifically for people that live in Taney County. So basically anybody that lives in Taney County is welcome to have taken this.
And that's a record for you. 1,700 is the most you have had participate.
Absolutely. And I think why it's so important is just that, again, really this is for the sake of the community. And we want to be sure that we're meeting our residents and our community's needs. And so their voice is so very important in this. Of course, we also lean heavily on data. So looking at what the numbers are saying. And then again, we also look at talking to some of our decision makers, people that have businesses, people, other health partners that might be serving some of our residents. And we compile all of that into the results. And really that's where we launch forward.
What are some of those results? You said mental health, obesity, and child abuse and neglect were top 3 priorities that you heard back from this assessment. Explain a little bit more about each one of those, and what else are residents telling you about these priorities? Why are these their priorities?
Sure. So we were not surprised to see these come to the surface. So over the last several community health assessments, we've had similar topics have risen to the top. And so we weren't terribly surprised, but the way that our community has framed these is a little bit differently. And that was kind of interesting to see because that will really impact how we go forward in addressing these with our partners collaboratively. I think, so basically, like I said, we send this out to all of our Taney County residents, and some of the interesting things that we really lean heavily on are a couple of questions that we get from we ask the residents. And the first one is, what are the top health concerns that you're seeing throughout our community? And certainly we saw those 3 come to the top: mental health, obesity, child abuse and neglect. And then the second most telling question is, what are the most risky health behaviors that you are seeing personally? And so with those, we saw things like poor food and nutrition choices, substance abuse, and secondhand smoke were top in that category. So you can see how these health behaviors really lend to some of these health priorities that we've got going on. And then also when you look at just our top causes of death in Taney County, 5 of the top 10 are directly attributed to lifestyle and behavior choices. And so it very much aligns with, we're seeing that this is how our residents are dying, and this is the behaviors that are leading to that. And so that's very interesting and also telling for us for what we need to do in the future.
Was that surprising to you, or maybe even hopeful, that people are recognizing some of these things are related to behavior and some things we are choosing to do?
Sure, absolutely. That was just really good information to see that our communities have a really great awareness of what causes health outcomes. So they've got an understanding that it's not just, health doesn't just happen in a doctor's office, that it really happens in the home. It happens in your environment, in your work setting, it happens out in the community. So really looking at how do we impact those arenas is and not just, the clinical care piece of it. So that's a new focus that the health department has taken on over the last few years. I think one of the things too that we were really interested in seeing is that with mental health, we saw that over 40% of our respondents said that that was the #1 top health priority in our community, which really is very interesting that almost half of our residents thought that that was the #1 health issue in our community.
What do you do with these results now? How do you move forward and plan to address these issues? These are big issues, and that maybe in the next 3 years is not something you will fix 100%, but in the next one, in 3 years, you want to see improvements. Mental health, obesity, child abuse and neglect, huge issues. How do you plan forward to fix it and to address it?
So that really comes down to the fact that, as I said earlier, this isn't just the health department's assessment. This really belongs to the community, all of our community partners, all of our stakeholders. And so no organization can tackle these huge topics alone. And so we lean very heavily on our community partners, looking at what is already happening, what are some evidence-based programs that are proven to work and proven to have results, how do we all work together collaboratively and collectively so we have the biggest impact. So we get these top 3 priorities, and then from there we pull together our community partners and we say, okay, how do we want to address these moving forward? And so that's where we are right now. We've had, we call it our Community Health Improvement Plan. So we've been having meetings around that. We've looking at the first couple of these priorities, and so now we're looking to make plans around the other one. And so that's really where we are now, and knowing that the health department isn't going to be the only player in this, and that really we've got to, as a community, come together, especially when you see these very large-scale health problems.
And what is your website once it is up so people can check it out?
Sure, it's www.taneycohealth.org, and then we also have a Facebook page, so please feel free to like us, to check out our progress there. And again, if you're interested in any input or any of these meetings for our action planning, they're always welcome to give us a call, check our website, reach out to us on Facebook, and we'll get back in touch with dates and information.
All right, Lisa Marshall with the Taney County Health Department, thank you so much for being here.
Thank you.
We'll be right back with more right here on Ozarks Fox.